Welcome to Clinical Capsules, where we bring you the same evidence-based insights you trust from TRC Healthcare, now in podcast form. This year, we're celebrating 40 years of keeping healthcare professionals ahead of critical medication updates and guidelines. Every second and fourth Tuesday, our expert editors from Pharmacist Letter, Prescriber Insights, and Pharmacy Technicians Letter will break down the most impactful clinical developments, giving you clear, actionable takeaways in just minutes. Today, you'll hear an excerpt from our October 2024 Pharmacy Essential Updates Continuing Education webinar series. In this segment, Associate Editor and Pharmacist Vickie Danaher explains how the recently approved epinephrine nasal spray compares to the injectable products for treating anaphylaxis. With that, let's get started.
When we talk about epinephrine, many people usually think of a traditional epi-pen or auto-injector that needs to be injected. But now, like our article says, you'll hear buzz about Neffy, the first epinephrine nasal spray for treating severe allergic reactions, including anaphylaxis. So this is a pretty big deal, since we know that injectable epinephrine products have been the go-to for decades. So we'll need to be ready to answer patient questions about the different options and how they stack up. And we can start to think about this with a patient case. So this is Rose. She's a 3-year-old patient at your pharmacy. Rose is allergic to peanuts, and she's been prescribed an epinephrine auto-injector, which her family has had to use in the past. But Rose's mom says she recently heard there's now an epinephrine nasal spray available. She wants to know if Rose can or should get that nasal spray version instead. So what would you do in this situation? What would you want to know to help determine whether the nasal spray could be an option for Rose? And it's probably not too surprising that many patients will be interested in getting an epinephrine nasal spray instead of an injectable. We know that many patients and their caregivers fear needles, or they don't feel comfortable giving epinephrine. Or when they do use these products, they use them incorrectly. And we know this is a big problem since it can delay or prevent patients from getting life-saving treatment. And then there are problems with actually having the med on hand, for example, due to high costs or ongoing shortages. And another issue is that people often wait too long to give epinephrine because they don't recognize symptoms of anaphylaxis. But the good news is that we as pharmacists and technicians can help address many of these barriers. For example, more states are following the trend, allowing pharmacists to furnish epinephrine under a protocol or standing order, similar to how many pharmacies now provide naloxone or contraceptives. Plus, as pharmacists, we can help patients and their caregivers recognize what anaphylaxis is and how to manage it. So for example, we can educate that some of the red flag symptoms of anaphylaxis to be aware of include things like swelling of the lips or tongue, tightness or hoarseness in the throat, or shortness of breath, coughing, or trouble swallowing. Sometimes the skin can also be involved, including itching, hives, redness, or swelling. And I think most people do tend to expect these types of reactions, but there's others to be aware of too. For example, a weak pulse, dizziness, pale skin color, severe vomiting, diarrhea, or cramps can also be a symptom of anaphylaxis. Or these may occur in combination with other symptoms. So these are the key things people should be keeping an eye out for, especially if someone's been in contact with a known allergen. And if a patient is having symptoms of severe allergic reaction, we know that giving epinephrine can reduce or reverse these symptoms quickly and help save their life. In terms of injectables, we know that most products come in several strengths and are dispensed based on the patient's weight. And as a refresher, the different devices include auto-injectors such as epi-pen or epi-pen Jr., Adrenaclick, as well as generics. And Auvi-Q, which has audio cues to talk the user through administration. There's also Synjepi, which is a pre-filled epinephrine syringe. Or in rare cases, patients may get kits, which are pre-assembled with vials of epinephrine, needles, and syringes. And again, now we have the first epinephrine nasal spray, Neffy, which is being touted as the first and only FDA-approved needle-free epinephrine product. Evidence suggests that epinephrine 2 milligram nasal spray achieves similar blood levels as injectable epinephrine, as well as similar increases in blood pressure and heart rate. But we want to be aware that these studies are in healthy patients who are not experiencing anaphylaxis, and real world use of the nasal spray is limited. Each carton of epinephrine nasal spray comes with 2 nasal spray devices, and each device is single use only and contains enough medication for 1 dose. I want to point out that the epinephrine 2 milligram nasal spray is only approved for patients who weigh 30 kilograms, which is about 66 pounds or more. So this particular strength won't be an option for many young children. But a 1 milligram dose for children who weigh 15 to 30 kilograms or 33 to 66 pounds is being reviewed by FDA. So we'll have to stay tuned for that. Plus, absorption of the nasal spray may be impacted by a history of nasal conditions such as nasal polyps or surgery. So these particular patients should discuss risks and benefits with their prescriber. But overall, we want to keep in mind that the best emergency epinephrine device is the one that patients and their caregivers are willing to use, carry with them at all times, and are able to use correctly. And this sometimes will boil down to what's in stock and what patients can afford. So we as pharmacists can continue to recommend an emergency epinephrine device based on patient preference, availability, and cost. So we can explain that a 2-pack costs about $710 for Nepi epinephrine nasal spray, $620 for the talking Auvi-Q injector, $300 for generic epi-pen, or $250 for some Simjepi pre-filled syringes. And remind patients that most manufacturers have copay cards or patient assistance programs, so most patients will pay less than these prices with savings or discounts. We also want to point out other differences that patients may want to consider when picking a product. For example, epinephrine 2 milligram nasal spray has a shelf life of 30 months from the date of manufacture. But most epinephrine injection devices are labeled with an expiration date of 15 to 20 months. So the nasal spray's longer expiration may be something to keep in mind, especially since we know that many epinephrine devices expire before a patient needs to use them. The nasal spray is also less sensitive to temperature excursions compared to other products, including epi-pen and Simjepi. The nasal spray can withstand temperatures up to 122 degrees Fahrenheit for a few days or be thawed and inadvertently frozen. When you dispense epinephrine nasal spray, we want to train patients and caregivers on proper use. The single-use device is the same design as Narcan naloxone or Imitrex nasal spray, and again, it contains enough med for 1 dose. So remind patients that the nasal device should not be primed or tested, as this will discharge that dose. Educate to hold the device with a thumb on the bottom of the plunger and a finger on each side of the nozzle. Insert the nozzle fully into one nostril, either nostril can be used, and then press the plunger to give a dose. Advise giving a second dose of the nasal spray in the same nostril 5 minutes after the first dose if needed. Now, we don't have time in today's session to walk through each injectable epinephrine device, but we know that there's brands and generics, and they're all a little different. But do be aware that these devices are often used incorrectly. So this is a good reminder to train patients and caregivers on proper administration of any device, especially if they're switching from a product than what they've used before. And if you have a training or demo device available, that's really a great way to walk through the process and have patients practice. And also remind patients and caregivers to always call 911 if a dose of epinephrine is given. And part of the reason to call 911 is because of the risk of recurrence. Some patients have what's known as a biphasic anaphylactic reaction. As the name suggests, there can sort of be 2 peaks to the reaction. At the beginning, the person is exposed to an antigen like an insect sting. There's this acute initial phase where they may get epinephrine and the symptoms resolve. But then with biphasic anaphylaxis, symptoms can recur. And this can occur anywhere from within 1 to about 72 hours after that first initial reaction. Symptoms can be as bad as the first reaction, possibly better, possibly worse. And this can be a really big concern, especially if patients don't make it to the emergency department. These biphasic reactions can occur in up to 1 in 5 patients, but it's really hard to predict which patients will have these recurrent episodes. So, again, it's really important for patients to be aware of this. And this is one reason why we want to recommend having 2 epinephrine doses available, especially if patients have a prior severe or hard to treat reaction. These patients may be at a higher risk of having a biphasic reaction. Having 2 doses on hand is also important in other situations, such as if the person lives far from a hospital. And we want to clarify that antihistamines or corticosteroids do not treat anaphylaxis. So patients should rely on these instead of epinephrine. And one reason is that antihistamines or steroids work more slowly than epinephrine. And they also do not prevent biphasic anaphylaxis. But an antihistamine or steroid is okay to add after a dose of epinephrine if needed to treat hives, itching, or other continued symptoms. On top of that, some data suggests that about 1 in 3 kids who go to the emergency department with anaphylaxis leave the emergency department without a prescription for epinephrine. So if patients are discharged for anaphylaxis, we want to verify that they're prescribed epinephrine and also ensure they have an anaphylaxis emergency action plan to help them remember or to help inform caregivers or other people, such as the patient's teachers, about how to respond to allergic reactions. These action plans lay out the red flag symptoms, walk patients through the steps of what to do so that the patient or their caregiver can act promptly. And this type of plan should be kept on hand right along with the patient's epinephrine. And one thing to call out here is that the caregiver or patient should not hesitate to give epinephrine for these red flag symptoms and make sure to give it promptly if they do suspect a severe allergic reaction. Now, a few reminders when you get epinephrine prescriptions: ask for and document the patient's weight and double check doses, especially as children grow. For example, we know that most injectable epinephrine devices come in zero point 0.3 or 0.15 milligram doses. That zero point 0.3 milligram dose is usually for patients who weigh 30 kilograms or more, and the 0.15 milligram dose is for lighter weight kids. But if doses aren't increased as the children grows, that dose may be too low. Remind patients to check the expiration date of their device and make a note on their calendar or in their phones to refill it before it expires. In general, we want to advise not to rely on expired epinephrine, but a recently expired product could be tried in a pinch if no other option is available. And we in the pharmacy can also continue to follow good inventory control practices, such as checking expiration dates and rotating stock, so that most patients get a product that will last at least a year or more before expiration. And for more on how the different epinephrine products stack up and to order demo devices for patients to practice with, you can see our resource, Emergency Epinephrine Devices. Also, check out our Managing Anaphylaxis resource. It has tips on recognizing symptoms of anaphylaxis, performing follow up, and the role of other medications in treating allergic reactions.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app. Or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. And if you're a student, good news. Students can access a free version of Pharmacist Letter. We've linked to that directly in the show notes as well. Check it out. Find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening to Clinical Capsules.